So I want to talk about a 2015 article by Michael Chapman entitled Johns Hopkins Psychiatrist, Transgender is Mental Disorder, Sex Change Biologically Impossible. And if you've ever looked into transgenderism being a mental disorder before, I would assume you've probably heard of Dr. Paul McHugh. But for those of you who don't know who he is, Dr. McHugh is an American psychiatrist, researcher and educator, and is the University Distinguished Professor of Psychiatry at the Johns Hopkins University School of Medicine, and he's authored several works in the field of psychiatry, and has made quite a name for himself. I've posted a link to the article that I'm going to be discussing in the description for you to go and read for yourself, but I am going to go through the entire thing in this video and give my opinions on what Dr. McHugh has to say. Before I dive into the article, I want to disclose something first. In my previous videos, I've generally used passive language when discussing transgender people, and I didn't include myself in the group when I discussed them. I considered doing the same for this video as well, but after reading the article and sort of playing about with what I want to say about it, I've realised that most of the opinions I formed come directly from my own personal experiences. So, full disclosure, I'm transgender myself. I've been living as a male since 2013, but that doesn't stop me from being able to put my reason over my emotions. And there are a lot of things in this article that I disagree with, but there are things I also strongly agree with as well. That's probably going to piss off some other transgender people watching, but I will of course explain why I hold these opinions and hopefully ignite a good discussion in the comments. It starts off saying that Dr. Paul R. McHugh, the former psychiatrist-in-chief for Johns Hopkins Hospital and its current Distinguished Service Professor of Psychiatry, said that transgenderism is a mental disorder that merits treatment and that sex change is biologically impossible, and that people who promote sexual reassignment surgery are collaborating with and promoting a mental disorder. Now, I'm obviously not a professional, so my response is just my opinion, but I have been reading up on gender dysphoria for almost 6 years now, so I'm not jumping headfirst into this topic with my head jammed up my arse, okay? So the first thing that he mentions is whether or not transgender people have a mental disorder. I would call it a mental disorder. According to the National Alliance on Mental Illness, and everything I cite in this video will be linked in the description as well, it says a mental disorder is a condition that impacts a person's thinking, feeling or mood, and may affect their ability to relate to others and to function on a daily basis. And that's what gender dysphoria is. It's when someone thinks or feels that they were born as the wrong gender, and it brings them a lot of distress. They're very uncomfortable in their body to the point where they will go through with hormones and surgery, and in the unfortunate cases it will actually drive them to suicide. So it does see them struggling to function in normal life. So yeah, I do think that being transgender is a mental disorder. So this begs the question, how do you treat gender dysphoria? Well, Dr. McHugh believes that a sex change is biologically impossible. Again, I agree. I don't think that transgender people become real men or real women when they transition, and I use the word real, I mean biologically male or female. They still possess the chromosomes of their birth gender, and so biologically they're still male and female. What we do is transition physically through hormone therapy and surgery, and we live and pass as our preferred gender. So the first 2 points I agree with McHugh. However, he also says that people who promote sexual reassignment surgery are collaborating with and promoting a mental disorder, and this is where I firmly disagree with him. There are two schools of thought when it comes to treating transgender people, and the first is that we should be given hormones and surgery, thus alleviating our gender dysphoria and enabling us to pass and live happily and successfully as our preferred gender. The second school of which McHugh is advocating is that people should not be given access to hormones and surgery, and instead they should be given counselling and therapy to make them, try to make them comfortable as living as their birth gender. I believe that the best way to treat gender dysphoria is to allow an individual to transition, and the reason why I chose to inform you at the beginning of this video that I'm transgender myself is because transitioning helped me, but I'll get into that a little bit later on. So the article continues. Dr. McHugh, the author of 6 books and at least 125 peer-reviewed medical articles, has made his remarks in a recent commentary in the Wall Street Journal, where he explained that transgender surgery is not the solution for people who suffer from a disorder of assumption, the notion that their maleness or femaleness is different than what was assigned to them biologically. The main point I want to discuss here is this notion of maleness and femaleness. I've already spoken briefly in one of my other videos about it, but I'll put a hypothetical scenario to you to make my point. Imagine a little boy who prefers girls' things. He prefers wearing pink, he likes wearing dresses, he likes dolls, he doesn't like going out and getting dirty with the other boys, he likes to stay in his room and, play mum or kitchen or tea set or whatever you call it. This is sometimes used as proof that this little boy wishes he was born female, and I couldn't disagree more. If a little girl likes boys' things, that doesn't mean that that little girl wants to be a little boy, and same with a little boy who likes little girls' things. Stereotypical maleness and femaleness has nothing to do with your sex and your genitals, and you can be a feminine man or a masculine woman, and that has no bearing on your gender. Saying that girls like pink and boys like blue, and girls like dolls and boys like climbing trees and all that, it's bullshit, because all little girls and little boys are different and have their own individual set of preferences and unique personalities. When I debate with transgenders, or trans-trenders as I prefer, on Tumblr, and they say things like, I knew I was trans from a very young age because I wanted to wear dresses and I liked Barbie. And I completely disregard that as any kind of evidence. Playing with dolls and wearing dresses does not make you a girl. Having a vagina makes you a girl. Having gender dysphoria because your sex characteristics that you were born with makes you uncomfortable and distressed. That's what makes a person transgender. And in my video response to Justin Dennis, he mentions trans women and makeup, and how a trans woman who decides not to wear makeup will have people coming up and saying, are you sure you're trans? And I agree with that, because if a woman doesn't need to wear makeup to be a woman, then a trans woman shouldn't be expected to wear makeup to be a woman either. So to me, maleness and femaleness and how we express those things, it doesn't have anything to do with our gender. Because I know gay guys who love stereotypically female things, and I know tomboyish girls who prefer stereotypically male things, but that doesn't make them transgender. A biological female wanting to shave off her hair is one thing, but a biological female wanting to cut off her chest is another thing, or a biological male wanting to cut off his penis. That's transgenderism. So the article continues. He also reported on a new study showing that the suicide rate among transgender people who had reassignment surgery is 20 times higher than the suicide rate among non-transgender people. Dr. McHugh further noted studies from the Vanderbilt University and London's Portman Clinic for children who had expressed transgender feelings, but for whom over time 70 to 80% spontaneously lost those feelings. Now, I'm sure we've all heard the high suicide rate. Yes, the suicide rate is very high, but suicide is also very high in other demographics, such as young gay teens, especially in places like the Middle East, and I don't know if it's still high anymore, but it used to be particularly high for gay teen boys in the southern belt in America. So you don't hear about the majority of the success stories when it comes to transgenderism. Obviously not all transgender people who transition are killing themselves. I'm still here. So we get on with our lives without broadcasting the fact that we're trans. Most trans people who successfully pass and live as their preferred gender, including myself, don't even refer to ourselves in our day-to-day lives as trans men and trans women, but rather just men and women. It's a non-issue most of the time. It's the suicides that make the news, not the average trans person just getting on with their life, and essentially they can go on and live their lives, and most people don't even know that they're trans. The people that I go to university with have no idea that I'm trans. So to say that due to the high suicide rate, We need to stop allowing all transgender people from transitioning and instead give them all therapy. It's ridiculous. Every individual case is different. And this was the point that made me want to tell you that I'm trans myself, because I'll tell you right now, if I'd been told on that day, all those years ago when I walked into that clinic, if they'd told me that I would never be allowed to transition and instead they were just going to keep giving me counselling, I would have went straight home and I would have killed myself. And I'm not being dramatic, I'm being bluntly honest. And I've spoken to other trans people in America and Canada and all over Britain. I've got a friend from Finland, and they all share this sentiment with me. If you forbid transgender people from transitioning, the suicide rate won't drop. If anything, I'd argue that it's going to increase, because like abortion, if people want a procedure badly enough, they will find a way to get it, whether it's illegal or not. And trans people would turn to far less safer ways to fix their bodies, and the suicide rate would remain the same at best and increase at worst. However, concerning the statistics of trans children losing their feelings, and this is where I know I'm going to piss a lot of other trans folk off, because I completely agree with McHugh here. I don't think that children beneath the age of 16 should be given hormones, and they certainly shouldn't be given surgery. Sure, let them dress up. If a little boy is talking about his gender identity and he thinks he wants to be a girl, let him grow his hair, let him wear dresses, let the little girl cut her hair and wear boys' clothes. But young children don't have the mental capacity to understand the irreversible consequences that will come with hormones. Kids are brought up to see the girls' toys in the girls' aisle, the boys' toys in the boys' aisle, the girls' clothes in the girls' section, and the boys' clothes in the boys' section. So a tomboy, a little girl who's a tomboy, would reason in her head that if she likes things from the boys' aisle and likes clothes from the boys' section, she must be a boy. Well, when she grows up and matures and realises that it wasn't that she was a boy, she was a normal girl that liked stereotypically boys' things, if she's been on hormones, the damage is already done. So no, I don't think that children should be allowed to transition. Not until they're legally an adult, which here in Scotland is 16. So the article says, while the Obama administration, Hollywood and major media such as Time magazine promote transgenderism as normal, says Dr. McHugh, these policymakers and the media are doing no favours either to the public or to transgendered people by treating their confusions as a right in need of defending rather than as a mental disorder that deserves understanding, treatment and prevention. Again, there's parts of this I agree with. I do think that the media is doing no favours with its promotion of transgenderism as something to be celebrated. I mean, that whole media circus around Caitlyn Jenner was ridiculous, and the shaming that befell anyone who disagreed with it was disgusting. It shouldn't be fashioned up and promoted as something stunning and brave, and anyone who voices a differing opinion shouldn't be hailed as a hateful bigot and a transphobe, because it's only going to encourage, those crazy kids over at Tumblr to embrace this kind of thing all too enthusiastically. You've seen it in my videos where I've spoken about people like Milo Stewart are a very good example of this. So transgenderism, as already discussed, is a mental disorder, and while I agree that the cure is to transition, the thought of it being celebrated as some kind of an achievement makes my skin crawl, because you see kids lapping it up, looking at the attention that people like Caitlyn Jenner, Jazz Jennings, Laverne Cox, they got all this attention and people were so impressed with them. Little impressionable kids are going to look at that and think, I want that too. And McHugh has already said that it should be treated and prevented. That I disagree with, obviously, but I understand where he's coming from, because directly relating to the high suicide rate, I believe, is the fact that many of the people who are deciding to transition these days, specifically in the past couple of years, they're not even trans to begin with. They're trans-trenders like Milo Stewart, or snowflakes who went that step further and claimed to be genderless, like Lanybot, both of whom I've done videos on. And then there's Justin Dennis, who openly admitted in the video that he never even questioned his gender until he went to college and found out what transgenderism was. So it's one big vicious circle of people thinking it's trendy, actually transitioning, realising too late that it was a mistake and it was a trend, and then unfortunately sometimes killing themselves. So we need to stop normalising transgenderism and throwing it out into the media as if it's some kind of fashion statement. We need to stop reporting on it as if it's stunning and brave, and then maybe we'd see a drop in the amount of transgenders, and as a result a decrease in the overall suicide rate. I mean, one of the most tragic cases reported on was that of Leila Alcorn. She killed herself because she wasn't allowed to transition. So it goes both ways. The transgendered person's disorder, said Dr. McHugh, is in the person's assumption that they are different than the physical reality of their body, their maleness or femaleness, as assigned to them by nature. It is a disorder similar to a dangerously thin person suffering from anorexia who looks in the mirror and thinks they are overweight, said McHugh. I've had this brought up to me before when I've spoken to people online and they've said transgenderism is the same as anorexia. Anorexic women or people, anorexic people who look in the mirror and see something fat, or obese people who look in the mirror and don't see a severe health problem coming on, is just the same as a transgendered individual who looks in the mirror and is disgusted with their body. No, it's not the same, because it's the anorexia that will eventually kill the anorexic. It's the obesity that will eventually kill the overweight person. It's not the transgenderism or the gender dysphoria that kills the transgendered person. It's suicide, it's depression, it's things that will alleviate if a transgender person who's really transgendered to begin with is able to transition. When someone's anorexic and they continue to starve themselves, their body shuts down and they die as a result of that. Obese people with the dozens of health complications that come with someone being too fat, such as heart problems, kidney failure and things like that, that's what kills them. Transgendered people don't die from dysphoria, they generally die because they kill themselves, because they can't deal with the fact that, in the case of Leila Alcorn, they can't transition. So, no, I resent that comparison. Anyway, returning, this assumption that one's gender is only in the mind regardless of anatomical reality has led some transgender people to push for social acceptance and affirmation of their own subjective personal truth, said Dr. McHugh. As a result, some states, California, New Jersey and Massachusetts, has passed laws barring psychiatrists, even with parental permission, from striving to restore natural gender feelings to a transgender minor, he said. Again, I agree with this whole pushing for social acceptance. Of course, it should be stated that transgender people are people and we should be afforded the same respect and courtesy as everyone else, but glamorising it, sticking transgendered people on Time magazine and making them Women of the Year is not a good idea, in my opinion. I'm not saying that because these people happen to be disordered doesn't mean they can't be celebrated in that, but the way that it's being put out there as this beautiful trans woman, why do you need to call her a trans woman? Why not just call her a woman? Stop promoting trans as a thing. But again, I agree with McHugh that children shouldn't be given access to hormones. If you disagree with me, by all means, put a rant down in the comments and we can have a conversation about it. Goes on to say, the pro-transgender advocates do not want to know, said McHugh, that studies show between 70 and 80% of children who express transgendered feelings spontaneously lose those feelings over time. Also, for those who had sexual reassignment surgery, most said they were satisfied with the operation, but their subsequent psychosocial adjustments were no better than those who didn't have surgery. Again, this is going to be different for every individual case. Speaking for myself, I can very confidently and honestly say that transitioning saved my life. I'm the happiest I've ever been. I'm the most stable and productive I've ever been. Transitioning saw me returning to university, returning to work. I'm the healthiest I've ever been because I've started going to the gym. I'm the happiest I've ever been. I'm no longer reliant on alcohol. I'm just... The transformation is almost miraculous, and it's not just physically, it's mentally. All my friends and family are commenting on how much happier I am. Before my transition, I was a complete mess. I was suicidal. I had suicide attempts. I was just a complete riot. Transitioning saved my life, and a lot of the other trans people that I speak to from America and my friend from Finland, they all share that sentiment as well. So while there will be people who resent the transition and kill themselves as a result, to say because of that demographic every transgender person needs to lose their ability to transition is just ridiculous. And so at Hopkins, we stopped doing sex reassignment surgery since producing a satisfied but still troubled patient seemed an inadequate reason for surgically amputating normal organs. Again, you've come across a few or maybe a lot of people who said they were just satisfied. I'm more than satisfied. So it should be judged on a case-by-case basis. Rather than saying no trans people should be allowed to transition, you should be saying we're going to be a lot more stringent in our evaluating processes on deciding who's going to transition. Because I'll tell you right now, if I was a surgeon and someone came into my office and I said, tell me why you think you're trans, and they said, oh, when I was a little girl I wanted to cut all my hair off and I liked boys' toys, I'd tell them to get the fuck out of my office. If they came in and they said, I can't stand to look at my body, my breasts make me feel sick, I want them off, when I look at my anatomy it feels alien to me, that would be a case for strong consideration for transition, in my opinion. So it goes on to say, the former Johns Hopkins Chief of Psychiatry also warned against enabling or encouraging certain subgroups of the transgendered, such as young people susceptible to suggestion from Everything is Normal sex education and the school's diversity counsellors, who, like cult leaders, may encourage these young people to distance themselves from their families and offer advice on rebutting arguments against having transgender surgery. Again, this is a very good example of why I make the videos that I do, why I've made the video on Milo Stewart, Lainey Bott and Justin Dennis. This susceptibility to suggestion that you're seeing on people and you're seeing just pouring out of Tumblr, that is so infuriating to real trans people, because they sit there and they say, oh, I probably won't get surgery, oh, you know, I'm not really that bothered if I ever take hormones, I don't really give a fuck if people use the pronouns. And I'm sitting here like, you're not trans. Stop telling people this is what trans is. This is why we're not taken seriously anymore. Back in 2013 when I started living as male and people found out I was transitioning, some people found it a little bit weird, but there was no hostility. People didn't know what it was. Transgender wasn't a household name. So it was a non-issue. People were just kind of like, oh, right, well, fair enough, okay, whatever you want to do. Now, because it's been shoved down people's throats, because it's became this thing where if you don't support Caitlyn Jenner, you're a bigoted transphobic prick, people are now taking umbrage and they're getting pissed off, and you're seeing far more hostility now towards transgender people than there was even just 3 years ago. And that is a direct result of the trans trenders and the other people crawling out of Tumblr treating it like a fashion statement, and it's fucking infuriating. Fucking liberal campuses. Anyway, it says, Dr. McHugh also reported that there are misguided doctors who, working with very young children who seem to imitate the opposite sex, will administer puberty-delaying hormones to render later sex change surgeries less onerous, even though the drugs stunt the child's growth and risk causing sterility. And again, that's more underlying why I disagree with giving children under the age of 16 hormones, because at that age they are far more susceptible to imitating the opposite sex in their behaviour, but not actually feeling like the opposite sex, if you know what I mean. It says such action comes close to child abuse, said Dr. McHugh, given that close to 80% of those children will abandon their confusion and grow naturally into adult life if untreated. Completely agree. Sex change is biologically impossible, said McHugh. People who undergo sex reassignment surgery do not change from men to women or vice versa. Rather, they become feminized men or masculinized women. Claiming that this is a civil rights matter and encouraging surgical intervention is in reality to collaborate with and promote a mental disorder. Again, my opinion on biological impossibility, I don't think of myself as a real man. I'm not biologically male. I still have female chromosomes, but I pass as male, I feel male, I live as male. All my professors and peers at university, my work colleagues, everyone in my life that didn't know me prior to my transition has no idea when they look at me and speak to me that I'm female. They see me as male, they treat me as male, I feel male, I live as male, and that's what matters to me. It's always going to be a sinking feeling in my chest that I'm not biologically male, but I've done the best that I can, and I don't see that as catering to my mental illness, because like I said, if I'd been told by my counsellors, and that's the other thing, while I'm talking about it, a lot of the other people that I'm arguing about this topic with, they say things like, you shouldn't be able to just wake up one day and then go to your doctor and say that you want to be a man or a woman and then boom, you're on hormones. That is not how it fucking works, or at least that wasn't how it worked for me here in Scotland. It took me years to be able to admit it to myself, and then when I finally went to my doctor and I got in contact with the gender clinic, I was on that waiting list for 13 months. And then after I had my initial consultation and had my evaluation, it was 6 more months before they got back to me, said that they had decided that I was a viable case and that they were going to put it forward to the gender team. It was then a further 6 months until they got back to me and said, right, you've evaluated and we've found you suitable, and when your doctor sees fit, they'll contact you when you have to get your first shot. And then it was another 2 months before my doctor contacted me and said, come and we'll give you your first shot. So for me, it was over 2 years from my first appointment until actually starting to transition. So it's absolutely not something that you can just wake up and go through with. It's not that easy. They're very strict, they're very stringent. I had to see multiple counsellors. I also saw a psychiatrist, and one of the specialists that I saw, I wouldn't say she was trying to discourage me, but she was saying things like, are you absolutely sure that this is what you want to do? Do you understand the effects? These are all the cons. This is what could happen. She actually pulled up images on her computer of the before and after pictures of the surgeries. She kept talking about the big cons and making sure that she was hammering the fact home that I'm far more likely to get cervical cancer, that the illnesses that I used to have a stronger defence against, I'm now far more susceptible to them, and all the other cons that come with taking hormones. And these are the things that you need to be realistic about. All of that to me is worth it. And having those conversations and those interactions weren't fucking easy, but it was all worth it. I've lost my fucking place now. What was I saying? Claiming that this is a civil rights matter and encouraging surgical intervention is promoting mental disorder. Okay. I don't think that it's encouraging a mental disorder. I think that it's helping it. Because as I've said, transitioning saved me and it saved other people as well. In order to deal with something such as gender dysphoria, it really does need to be taken on a case-by-case basis. I do think that the statistic that's given, I think, I'll need to look it up actually, but I think it's 0.3% of the population is supposed to be transgender. I think that it's far less than that. I think a big part of that percentage is made up of people claiming to be trans, like Milo Stewart, who aren't. We're a very, very tiny part of the population. And those of us who are actually transitioning, totally not regretting it at all, we're even smaller. So if you're taking it on a case-by-case basis, if someone like Milo Stewart or Justin Dennis or any of the other people that clearly belong on Tumblr came into my office and were like, I want surgery, I'd be like, no, get the fuck out, because you just know that it is just a college thing to them. Justin Dennis walking into college and finding about it for the first time and then suddenly deciding, oh yeah, I'm trans. Milo Stewart saying that she's trans even though she's in love with her body. It's bullshit, it's ridiculous, it blows my fucking mind and boils my blood. So that was the article. I'll link the article below. I'll link the NAMI website and stuff like that. I want to know what other people think of this, because I know that some of the opinions that I hold, such as when it comes to children and hormones, even just referring to gender dysphoria as a mental disorder, I do know some trans people that disagree with me on that. I think the reasons that I've put forward make sense, but if you disagree, by all means, we'll have a conversation about it. So let me know what you think, and if there's anything else that you want to contribute or expand on, if there's any other cases that you've found that you find really interesting, then post them and everyone can have a look at them. As you've probably noticed, I did get a new mic. I was recording my previous videos on my phone because my good mic broke, and I've just got this one. It's still a shit mic, I'll give it that, but I think it's a lot more clearer. And oh, Cat's just walked up to the mic. Say hello. Thanks for listening.